Mindset Monday. I hope you had a wonderful weekend and I hope you had a great Monday, whether at work or at play. Today, I have a special guest as we bring the curtains down on Breast Cancer Awareness Month. I am so happy that we have a wealth of information, whether from breast cancer survivors or educators in the form of our physicians or friends. And these information are valuable because they're coming from trusted sources. Our primary care physicians are the ones who help us stay on top of our health. But of course, if we do not go to our primary care physician, we will not be able to know what's going on, understand what we should do next in anything that we are falling short. And the person that will be gracing us with her presence today is Dr. Danielle Marsh. I just give you a little bit about Dr. Marsh. I've known her since she's been a very tiny tot. That tells you how old I am, okay? She is a third year family physician. She works at the Overlook Medical Center in Summit, New Jersey. Dr. Danielle Marsh, DO, has a passion for God, diversity, volunteerism, and mentorship. In 2015, Dr. Marsh graduated cum laude from Binghamton University, State of New York, where she earned a bachelor's in biological science with a minor in Judaic studies. In 2017, she completed her Master's of Science in Physical and Biological Science at Torah College of Osteopathic Medicine, Harlem campus, securing her a seat in the incoming medical school class at the same institution. As a medical student, Dr. Marsh served as tutor to her peers in various subject areas, including anatomy, osteopathic manipulative medicine. As, as the former vice president of the local chapter of Sigma Phi National Osteopathic Honor Fraternity, she enlisted students to participate in the local food pantry and coordinate the biannual health fairs, which provide free health services to underserved community in Harlem. As the former chair of the diverse task, she collaborated with different student organizations to discuss topics of diversity and inclusion within the school and the Harlem community at large. Due to her volunteerism at a local hospital in Rockland County during the height of COVID-19 pandemic in 2020, Dr. Marsh was awarded the Scrub Caps for a Cause Scholarship with the designation of Fauci Scholar, receiving a personalized letter from Dr. Fauci himself. She graduated from Torah Com in 2021 with her doctorate in osteopathic medicine, having been accepted at her number one choice residency, overlooking family medicine in Summit, New Jersey. There, she continued to hone her clinical skills as a physician while ensuring empathic care to patients at all age, both in the inpatient and outpatient setting. During her spare time, she enjoys being engaged in her home and church community of Mount Vernon, New York, where she resides with her parents and older brother. Dr. Marsh continues to participate at the Oneness Rehoboth Apostolic Church, which includes activities through preaching, mentorship, and social outings with youth. Ministries she continued to participate in include, but not limited to, the media and courtesy ministry, as well as the youth ministry, where she formerly served as youth secretary in 2016 and then as youth assistant pastor from 2020 to 2021. Her ultimate desire is to be a servant of the Lord in any capacity that brings glory to his name. Dr. Marsh, a servant in any capacity she sees fit. Help me welcome Dr. Danielle Marsh to Mindset Monday.
Hello.
Hello, Dr. Marsh. Princess Danielle, Dr. Marsh. How are you?
I'm good, thank you. How are you? Can you hear
I
me?
am, yes, I can. I can hear you clearly.
All right, awesome.
It's such an honor to have you this evening.
Likewise, thank you for allowing me to come on to your live stream. I don't take it lightly, so I do appreciate it. Thank you.
It's a pleasure. I can remember Dr. Marsh from she was going to, was it PS?
PS21. Oh wow, that's
Yes.
that's way back.
Yes, that tells me I'm getting very old.
Not necessarily. It just means that you've become a more seasoned young adult.
Yes, that's it. And rubbing shoulders with young adults like you, I remain young.
Exactly.
That's it. But it's such a privilege to have you, and knowing that you have gone through the rigors of study in several different areas, and you are standing tall in the capacity as a doctor and still holding the bloodstained banner of the Lord as center of your life.
Yes, definitely. This position is not for the faint in heart. I can definitely attest to having imposter syndrome and wondering if if this is something that I could really do. But God has been faithful and really has been my primary source of support and strength, and wisdom and knowledge, because He created the body, and so He has all the knowledge as to how it works, how it functions, and God has blessed individuals to be able to learn about this body that He's created. And I'm glad to be a part of, just being a servant for my community, and being able to help with healthier living. So,
Awesome, awesome. Well, this month we are actually looking at breast cancer awareness, and it's I know it's been, as one of my nurse colleagues said, it has been a demon in all of our lives, whether with a family or a friend or a co-worker. It has been throughout our existence. However, because of medicine and because of so many things, um, people are living longer and they're able to endure because of the resources that we now have at our fingertips.
correct. Yes, definitely. Just to kind of give some facts about breast cancer, it is one of the most frequent non skin cancer types, and it's one of the most frequent causes unfortunately, of cancer death in women worldwide is actually the second most frequent in women in the United States. And so that just makes it the more important reason why screening and early diagnosis is key to be able to have successful treatment once it is diagnosed.
Awesome. Awesome. So, Dr. Marsh is here to share with us information as to how to care for ourselves, making sure that we don't skip our doctor visits or, take things on ourselves and say, oh, I can take care of that next year or next week or whatever. She is here to share with us that our bodies need to be taken care of. Self-care is not selfish, but caring for ourselves that we can also care for others if needs be.
Exactly. And so, just some information just to kind of start off, just about the basics. So, what is breast cancer? So, basically, cancer in itself is just when normal cells sort of begin to change on their own and grow out of control. That's what cancer is. So, you can imagine that breast cancer is when the breast cells sort of grow out of control. And sometimes, yes, some people, they may feel a lump in their breast. That's usually the stereotypical way of being concerned about breast cancer. But a lot of times it's usually found just on routine screening tests before a lump can even be felt. One thing to note is that breast cancer, it is more common in females than in males, but anyone can get it. And sometimes it does run in families. So there is a genetic component when it comes to breast cancer as well. Not always, but there is a component of that. So that's why it's important that whenever you are concerned, if you're feeling something in your breast and you're just not sure about what it is, it's okay. That's why your primary care providers, that's what they're there for. Whether you see a physician or a nurse practitioner or a physician's assistant, whoever your primary care provider is, it's good to ask. You won't know unless you ask.
Awesome. Awesome. I know there I know for people who have had someone in their family, whether their mother, their father, or further in their family line, who were who were diagnosed with breast cancer. The physicians always say, make sure you get checked. But what I've heard from a younger friend of mine, she was diagnosed in her 20s. What can you share with our listeners, our viewers, as to what to do every month or routinely?
So usually, so I know that the old adage is, to do monthly breast self-examinations. I remember even growing up, my mom had the little breast self-exam card hanging in the bathroom, describing, how to check your breast, having your arm up, while you're showering, or just kind of palpating or just touching the breast, sort of in a circle to feel if there's any lumps or bumps. However, in recent years, actually, that has changed. We actually do not routinely suggest breast exams because a lot of times it can lead to invasive biopsies, and a lot of times they're found to be benign findings. And so that's why we have guidelines in regards to age groups as to when to do certain screenings. So, for example, mammograms. We recommend now, in recent years, the recommendations have changed where we start to screen a little bit earlier than 50 years old. So, usually 45 years and older, we start screening in women to check for breast cancer. Um, when you're age 40 and up, so between 40 and 45, we will introduce the idea about, breast cancer screenings and answer any questions that you may have about it. But in the case of the young lady that you mentioned, uh, that maybe it may have been, I'm not sure what her presentation was. Maybe she might have had some symptoms going on. Maybe there were some changes in the breast tissue itself. So what I usually recommend to patients in regards to sort of screening themselves in regards to breast cancer, I just tell patients, just understand how your breasts feel. When you're showering, and taking a shower, and you're washing your chest, washing your breasts, just understand how the architecture of your breasts are, not necessarily to try to feel for lumps, because sometimes the lumps that we may feel is just regular breast tissue, and maybe it just
Mm-hmm.
feels a little bit larger in one area than the other. But what is more significant is if that area that you're feeling that feels a little bit larger, if it's more distinct from the breast tissue that you feel in the rest of your breast. So if it's, much more well described or well circumscribed, if it feels hard versus soft. And so those kind of things you may feel just by just, doing your daily, washing in the shower, if you're taking a bath, however you cleanse yourselves. And if you just feel that you're just noticing, hey, this area feels a little bit different than the rest. I'm not used to feeling this area. Um, then that's something that you can bring up. A lot of times, some things that a misconception when it comes to breast cancer is that you'll feel pain. I
Mm-hmm.
rotated with a breast surgeon. This is her specialty in regards to doing surgical procedures, mastectomies, lumpectomies, and she said that 90% of breast cancer is painless. So you actually most more times than not will not feel pain when you have breast cancer, and sometimes you won't even feel a lump. And that's why I say that routine screening is key, because you may not feel a lump, and but that doesn't mean that something is not growing there. So I think in the young lady who was in her 20s, that was a more rare case. It's very rare for young women below the age of 40 to develop breast cancer. Most likely she was having some sort of symptoms, maybe some changes in her breasts were being seen, maybe some dimpling in her breasts. Was there any redness, um, any inversion of her nipples? I'm not sure what her specific case was, but uh, on average, it's usually 40 and up is where that's why we screen 40 and up, because that's when it
Mm-hmm.
most likely will be diagnosed and seen.
She just shared that little with me. I didn't want to pry too much because
Yeah,
it's very sensitive,
definitely.
so I just left it at that. How are you mentioned how they should do self-examination, and of course they're now advising against it, but do screening instead of self-examination. Um, what are the different stages of breast cancer, and how does someone approach the varying stages?
So, in regards to the different stages of breast cancer, um, so that terminology is more so what oncologists or specialists who specialize in cancer, what they use to group what type of cancer it is when someone is diagnosed. So just to kind of backtrack, when someone's diagnosed with breast cancer, usually it's found there's something that was suspicious found on a mammogram, and they would do a biopsy, usually like a fine needle biopsy, taking sample tissues from the area of concern, and then using a microscope to look at that tissue to see the presentation of the cells in that sample. And so when they talk about staging breast cancer, there's a what we call a TNM staging criteria. T stands for tumor, N, that's N as in Nancy, that stands for nodes, and M as in Mary stands for metastasis. So when you talk about the staging, we use those three categories to kind of group together how far advanced this cancer, the breast cancer is. So for example, tumor size depends on, how many centimeters, how large it is. Usually if it's less than 2 centimeters, that's like a stage one, stage two breast cancer. Um, Usually it hasn't spread to the nodes, meaning usually the nodes in your armpits, the lymph nodes, I should say. So that's the N portion of the TNM criteria, looking at the nodes to see if it has spread to the lymph nodes. And then the M in terms of metastasis basically is saying if it's detected, if the cancer is being detected outside of the breast, so going to the bone, to the lung, the liver. And so that is part of the staging, the grading, I should say, the staging and grading criteria. Usually, if it's a stage one or stage two breast cancer, like I said, the tumor is less than 2 centimeters. Um, Maybe sometimes in stage two, it might spread to the lymph nodes, or
Mhm.
it's the tumor is larger than 2 centimeters but smaller than 5 centimeters. Stage three, usually it will be a locally advanced breast cancer. And usually in those cases, the tumors are greater than 5 centimeters or 2 inches across. Usually they have spread to more than 10 lymph nodes. And you may also see some involvement of the soft tissues above or below the collarbone. When it's stage four, usually that means that it has metastasized or it has spread to areas outside the breast and the lymph nodes. So usually to like the bones, the liver, the lungs, or other organs. So that's what we use to kind of what we use to stage and um, to stage breast cancer.
Okay. Very good information. I did not know this. One of our viewers, Jennifer, she's asking if you breastfeed your children, does it lower your chances? She heard this before, never asked.
I've also heard that too. I think there may be some small reduction in risk with breastfeeding, but I don't think it's a large risk reduction. And kind of actually, just to kind of piggyback on what Jennifer was asking in regards to the risks for breast cancer. So there are several things that can increase your risk for breast cancer. So some of that is increase in age. So the older you get, the greater risk for breast cancer. We already talked about sex, so being female, unfortunately, is a risk factor. In regards to race and ethnicity, white women actually have the highest rates of breast cancer, and then after that, it will be black women, then like Native American Indians or Native Americans, and then like Hispanic women. It seems like it's lowest in Asian Americans or like Pacific Islanders. Another risk factor is weight. So patients or persons with obesity or with weight gain has an increased risk. I think it's related to the fact that the fat cells, they're able to make estrogen, and many people don't know that fat cells are a hormone organ basically, because it does produce hormones. It can create estrogen, and especially in postmenopausal women, that's the primary source of estrogen in postmenopausal women, is in the fat cells. So,
Oh,
so having a higher weight gain, having a higher BMI, so to speak, although BMI doesn't take into account like muscle mass and things like that, but having higher weight is also a risk factor in that sense.
okay.
Mhm. And I also have a little picture here. I don't know if I can, it's a blown up picture of a little, I don't know if you guys can see it very clearly. I think this blur uh, image thing is kind of interfering. But basically, what it's showing, and I'm sorry if it's not showing too very well, but basically, what it's showing is that the denser your breasts are, the increased risk for breast cancer. Reason being is that, so sometimes if you have had a mammogram, it may say your breasts are uh, heterogeneously dense or extremely dense, or scattered areas of density. It's basically just talking about how dense the tissue is. And what happens is that sometimes cancer can kind of hide behind that density. So that's why you're at an increased risk, because it's harder to find those cancers in dense tissue. So usually there is a criteria score um, that is used to kind of assess your risk of breast cancer, and usually they include that criteria. I don't know it off the top of my head, um,
Mhm.
but they usually include it in the report. And usually, if you have a, it depends on, like, your family background, your age, when you had your first period, when your period stopped, have you ever had any children? Because even not having children is a risk factor for a higher risk factor for breast cancer.
Okay.
Same reason, because of the estrogen, right? If you're pregnant, you're not producing, when you're pregnant, uh, you're not producing as much estrogen as when you're not pregnant, and so that kind of lowers your risk as well. So having more children lowers your risk. Having your periods later in age versus earlier is also lowers your risk, because of course you're not producing as much hormones. Having menopause earlier also is lowers your risk, because of course you're not producing the hormones uh, later in life. Um, and so those are just some of the ways that it lowers your risk.
One of the questions that they ask, are there any misconceptions or myth about breast cancer that you could debunk?
So we talked about pain. Breast cancer is usually painless. Um, Let me see. Other myths about breast cancer. I mean, there is many women have had successful treatment with breast cancer. It's I don't see it. It's In my opinion, I don't see it as a death sentence as maybe back in the past, because there have been so much great treatments, and especially specialized treatments to treat breast cancer, especially when it is um, caught early, in those earlier stages, stage one and stage two. And there are different treatments, depending on the cancer, how far it's spread, the growth of the cancer, and but there are the treatments that they have out now. A lot of women you have more stories of successful treatment than in the past. I remember I saw a patient with this breast surgeon that I rotated with, and she was so devastated when she learned that that they did find breast cancer, and it was just she didn't have any symptoms. She just did her first mammogram screening. She was in her
Wow.
40s, and they found it. But the breast surgeon was telling her that, based on the size of it, I think you're going to do well with treatment in terms of, successfully, being in remission and things like that, because she caught it early. So there is still hope, in regards to treatment for breast cancer. And they have support groups, women that have gone through this and have survived and lived, 5, 10, 15, 20 years after the diagnosis. I saw a lady who was, I think she was in her 80s, and she was diagnosed with breast cancer maybe like 20, 30 years prior. And she still looks good. She's doing well, didn't have a recurrence. So there is still hope, even in the midst of getting that diagnosis.
And how can we encourage more people to prioritize their breast cancer awareness?
I think just as we always, as health professionals, we always recommend, seeing your physician on a regular basis. Whenever I see patients, especially female patients, for their annual physicals. I do my own breast examination, just to be sure that, seeing them year to year, I could, tell if there's any differences from when I last saw them for their physical, and I can compare and contrast. And, also just asking questions, being in the know. There are great websites. You have the Susan G. Komen Foundation, you have the National Breast Cancer Foundation, so many resources to research and to learn more about breast cancer. And also talk to your family. A lot of times we don't realize that, as I said earlier, that there is a genetic component sometimes when it comes to breast
Mhm.
cancer. And something important to note is that, if you have a first degree relative, meaning mother or sister, and I'll include brother as well, because men can get breast cancer even though it's not as common. Um,
Mhm.
First degree relatives, depending on the age that they were diagnosed with breast cancer, the rule of thumb is that you, the individual, should get screening, um, 10 years before their diagnosis. So, for example, let's say your mom was 50 years old when she was diagnosed with breast cancer. Then you, as the daughter, should start doing mammograms at the age of 40. So, not waiting until 45, but actually doing it at the age of 40. Same thing, if your mom was diagnosed at 45, then you should, if you're 35 years old, 10 years, that will be 10 years before your mom was diagnosed, you at the age of 35 should start getting screenings, because there is a higher risk of you developing breast cancer because of that genetic, closeness.
Okay. Good to know.
Yes.
My sister was diagnosed in 2000, and I think it's 2008. She is now in remission. She was on the show 3 weeks
Hmm.
ago, shared her experience. She was explaining to us that if she was not, consistently checking on her health,
Hmm.
early detection definitely helps save life.
Hmm.
And she reminded us that it's not a death sentence.
Right.
Once you are in the know, then you're able to. So I since since she has been diagnosed, my mom never had breast cancer, but since she was diagnosed, I make sure every year I do my screening.
Definitely. And your sister said it so correctly. It's not a death sentence. And the fact
Yeah.
that, she was diagnosed in 2008 and now we're in 2023, it's been, I guess it'll be roughly 15 years, since that
Yes.
diagnosis. So there is definitely, you still have life to live. You still have things to do. It shouldn't, it doesn't mean that you should stop living life and enjoying what God has blessed you with. If you're a believer, you pray, you seek God's face, you continue to lean on His strength, but also in yourself, continue to do what you need to do. If it's working, if it's, spending time with family, whatever brings you joy, don't stop that, just because of a diagnosis such as this.
So, as we are on the mindset of health and the mindset of breast cancer awareness, it is sharing so much details as to how we can stay healthy, the mindset of health, getting regular screening, making sure that you don't dodge your doctor, because when Jesus was on earth, he also had a physician on his team.
Right.
So he that example is telling us that not everything is in one person. I'm an accountant. I cannot doctor myself.
Right.
I have to I have to go to Dr. Danielle Marsh because she has the experience. She is learned in that field to take care of us or give us advice. If she cannot treat, then she will know exactly the specific person, the specialist to send us to.
Exactly. Yes.
So it is so important to stay in the know about our health. Being healthy is a world of wealth that we have at our fingertip.
Definitely. And I mean, when we talk about, if you're thinking about, okay, how can I prevent breast cancer? Um, you know, I think what's important, as you already said, is to living a healthy life, and just you can't control your genetics, you can't control your age, you can't stop back the time, you can't control when you have your period, but things that you can control, so healthy eating, moving your body is important. Even at doesn't matter what age you are. It doesn't mean that you need to be a gymnast. No, you can, even if you have difficulties, whether it be because of joint problems or what have you, there's always different ways that you can still get movement in, to help to decrease weight gain. I do exercises at home. I love anything that's free. I don't have a gym membership. I just use free workout videos on YouTube. I found that has been beneficial for me. And I actually just came from a conference, an obesity medicine conference in Texas over the weekend.
Yeah, we did.
And
We
so,
did.
just learning about healthy eating, moving your body, and also having that mindset, as you mentioned, because the Bible says that as a man thinketh, so is he. And so, having that positive mindset, and surrounding yourself with people that can encourage and support and uplift you, that is also important in just your overall well being.
Awesome.
Where's the corner?
It is always so gracious to see Princess Danielle. I call her Princess Danielle as I see her in church, because we go to the Mount Vernon Oneness Rehoboth, and she is always so gracious when we meet in the courtesy area or wherever she is. And just knowing that she's here sharing health information with us,
Well, you want there.
it's so enlightening. Any closing word, Dr. Marsh, as we wrap up Breast Cancer Awareness Month?
Um, I think the main things are, get your routine screenings. If you're 40 and up, start having that conversation with your primary care provider about screenings. Um, Understand how your breasts are just in general. And if you're ever concerned about anything, even if you feel like maybe it's not a big deal, when in doubt, just check it out. Um, the worst that they can say is everything is good, or, let's do further testing. But it's better to catch it early than to try to be in denial about something and wait until it's too late.
This is the Breast Cancer Awareness Month. We have gotten a wealth of information that we can take away and make sure apply them to our life. Consistent screening, do not dodge our physician, and eat healthy. Get your body moving, whether it's a skip or a jump or
Exactly.
a walk across the park. Get in the moving so we can stay healthy. Many things we cannot avoid, as Dr. Marsh shared, but we can keep our body in a healthy state from the state of mind of our health in terms of positive thinking, stay around positive people, and just make sure that we are taking care of this vessel that was allotted to us. We are good steward of this body so we can impact, influence, and inspire each other. The mindset of health on this Breast Cancer Awareness Month. Thank you, viewers, for watching. Please remember to subscribe and leave your comments. I am Miriam Edwards for another episode of Mindset Monday with Dr. Danielle Marsh, Princess Danielle Marsh.
Thank you so much.
Thank you.